Dear viewers, this video is part 1 in the series on cancer, that is neoplasia, in the Medicine for Common Man series. Neoplasia, that is cancer. Epidemiology of cancer. The global impact of cancer. In 2018, it was estimated that there were over 9.5 million deaths caused by cancer worldwide, representing nearly 1 in 6 of all deaths. Moreover, due to increasing population size and age, worldwide cancer cases are expected to touch 21.4 million cases. Cancer-related deaths are projected to increase to 13.2 million by the year 2030. The most common tumors in men arise in the prostate, lung, and colon, rectum. In women, cancers of the breast, lung, colon, and rectum are the most frequent. Cancers of the lung, female breast, prostate, and colon and rectum constitute more than 50% of cancer diagnosis and cancer deaths in the United States. Cancer is the second leading cause of death in the United States. Only cardiovascular diseases exact a higher toll. Even more agonizing than the mortality rate is the emotional and physical suffering inflicted by cancers. Cancer is not one disease, but many disorders with widely different causations, natural histories, and responses to treatment. Some cancers, such as Hodgkin's lymphoma, are curable, whereas others, such as pancreatic adenocarcinoma, are virtually always fatal. The only hope for controlling cancer lies in learning more about its causes and pathogenesis. Fortunately, great strides have been made in understanding its molecular basis. So, dear listeners, by the way, this educational video is made possible by Prescribe-On, the makers of e-prescription software for digital prescriptions, available freely for doctors on the website www.prescribeon.com. Doctors who are interested in this e-prescription can freely avail of its vast collection of more than 100,000 e-prescriptions. Nomenclature. Neoplasia means new growth, and the collection of cells and intercellular tissue, that is stroma, composing new growths are referred to as neoplasms. Tumor originally described swelling caused by inflammation, but is now equated with neoplasm. Oncology, that is Greek, onkos means tumor. It is the study of tumors or neoplasms. A neoplasm is defined as a genetic disorder of cell growth that is triggered by acquired or less commonly inherited mutations affecting a single cell and its clonal, that is genetically identical progeny, the cells produced by the original cells, that is called progeny. These causative mutations alter the function of particular genes and give the neoplastic cells a survival and growth advantage, resulting in excessive proliferation that is independent of physiologic growth signals and controls. All tumors are composed of two components. One, neoplastic cells that constitute the tumor cells, and two, reactive stroma, that is intercellular tissue, made up of connective tissue, blood vessels, and cells of the adaptive and innate immune system. The classification of tumors and their biologic behavior are based primarily on the cellular component, but their growth and spread are critically dependent on their stroma. In some tumors, connective tissue is scant and the neoplasm is soft and fleshy. In others, the cells stimulate the formation of abundant collagenous stroma, referred to as desmoplasia. Some desmoplastic tumors, for example, some cancers of the female breast, are stony hard or scirrhous. Benign tumors. Benign tumors remain localized at their site of origin and are generally amenable to surgical removal. Predictably, the patient generally survives. Exceptions arise, however, when benign tumors occur in vulnerable locations such as the brain. Here, even benign tumors may cause significant morbidity and are sometimes even fatal. Naming of benign tumors of mesenchymal, that is connective tissue, the tissue in between the cells, mesenchymal origin is relatively simple. In general, the suffix "oma" is attached to the name of the cell type from which the tumor arises. Thus, a benign tumor of fibroblast-like cells is called a fibroma. A benign cartilaginous tumor is a chondroma, and so on. The nomenclature of benign epithelial tumors is more complex. Some are classified based on their cell of origin, others on their microscopic appearance, and still others on their macroscopic architecture. Adenoma is applied to benign epithelial neoplasms derived from glandular tissues, even if the tumor cells fail to form glandular structures. Benign epithelial neoplasms producing finger-like or warty projections from epithelial surfaces are called papillomas. Those that form large cystic masses, such as in the ovary, are referred to as cystadenomas. Some tumors produce papillary projections that protrude into cystic spaces and are called papillary cystadenomas. When a neoplasm, benign or malignant, produces a grossly visible projection above a mucosal surface, for example, into the gastric or colonic lumen, it is termed a polyp. If the polyp has glandular tissue, it is called an adenomatous polyp. Malignant tumors. Malignant tumors can invade and destroy adjacent structures and spread to distant sites, that is, metastasize. Malignant tumors are collectively referred to as cancers, derived from the Latin word for crab, because they tend to adhere to any part that they seize on in an obstinate manner. Not all cancers pursue a deadly course. Some are discovered at early stages that allow for surgical excision, and others are cured with systemically administered drugs or therapeutic antibodies. Nevertheless, the designation malignant always raises a red flag. The nomenclature of malignant tumors follows essentially the same method used for benign neoplasms with certain additions. Malignant tumors arising in solid mesenchymal tissues are usually called sarcomas, that is Greek. Sar means fleshy. Example, a fibrosarcoma and chondrosarcoma. Those arising from blood-forming cells are designated leukemias, literally white blood, or lymphomas, tumors of lymphocytes or their precursors. Malignant neoplasms of epithelial cell origin are called carcinomas. Carcinomas may be further qualified. In squamous cell carcinoma, the tumor cells resemble stratified squamous epithelium. In adenocarcinoma, the neoplastic epithelial cells grow in a glandular pattern. Sometimes the tissue or organ of origin can be identified and is added as a descriptor, as in renal cell adenocarcinoma or bronchogenic squamous cell carcinoma. In approximately 2% of cases, Cancers are composed of cells of unknown origin and must be designated merely as undifferentiated malignant tumors. Mixed tumors. In most neoplasms, all parenchymal cells closely resemble one another, but in some types of tumors, more than one line of differentiation, that is, different type of cells, is evident, creating distinct subpopulations of cells. A classic example is the mixed tumor of the salivary gland, which contains epithelial components scattered within a myxoid, that is, mucin containing stroma, that may contain islands of cartilage or bone. All of these elements are erased from a single neoplastic clone capable of producing both epithelial and mesenchymal cells. Thus, the preferred designation of this neoplasm is pleomorphic, that is, more than one type of appearances, pleomorphic adenoma. The great majority of neoplasms, including mixed tumors, are composed of cells from a single germ layer, that is, mesoderm, endoderm, or ectoderm. Note: in the embryo, three germ layers develop, namely the ectoderm, mesoderm, and the endoderm. Cells in each germ layer differentiate into tissues and embryonic organs. The ectoderm gives rise to the nervous system and the epidermis, that is skin, among other tissues. The mesoderm gives rise to the muscle cells and connective tissue in the body. The endoderm gives rise to the gut and many internal organs. An exception is a tumor called teratoma, which contains mature or immature cells or tissues belonging to more than one germ layer, that is, sometimes it contains all the three germ layers. Teratoma originates from totipotential germ cells that are normally present in the ovary. Note: a totipotent cell has the potential to divide until it creates an entire complete organism. Pluripotent stem cells can divide into most or all cell types in an organism but cannot develop into an entire organism on their own. Pluripotent stem cells can differentiate into any cell type found in the body and so, not surprisingly, may give rise to neoplasms that contain, in a helter-skelter fashion, bone, epithelium, muscle, fat, nerve, and other tissues. A particularly common pattern is seen in the ovarian cystic teratoma, that is dermoid cyst, which differentiates principally along ectodermal lines to create a cystic tumor lined by squamous epithelium that is replete with hair, sebaceous glands, and tooth structures. Environmental factors. Although both genetic and environmental factors contribute, environmental influences are the dominant risk factors for most cancers. Example: 1. A decrease in lung cancer incidence with lowered use of cigarette smoking habits over time. 2. The sharp drop in stomach cancer incidence during the 20th century, believed to stem from decreased exposure to unknown environmental carcinogens. 3. A recent increase in the incidence of liver cancer, which is likely due to 1. Rising rates of chronic hepatitis B virus (HBV) and hepatitis C virus (HCV) infection, and 2. Obesity. 4. The wide geographic variation that exists in the incidence of specific cancers. For example, the most common cancer of men in the United States and in most other higher income countries is prostate cancer. But in other countries or regions, cancers of the liver, stomach, esophagus, bladder, lung, oropharynx, and the immune system rise to the top of the list. Similarly, the incidence of breast cancer is generally much higher in women living in higher income countries than in lower income countries. Among the best established environmental factors affecting cancer risk are the following: infectious agents. About 15% of all cancers worldwide are caused directly or indirectly by infectious agents, with the burden of cancers linked to infections being roughly 3 times higher in the developing world than in the developed world. For example, human papillomavirus (HPV), an agent spread through sexual contact, has a causative role in the majority of cervical carcinomas and an increasing fraction of head and neck cancers. Smoking. Cigarette smoking is the single most important environmental factor contributing to premature death. Smoking, particularly of cigarettes, is implicated in cancer of the mouth, pharynx, larynx, esophagus, pancreas, and bladder, and most significantly in about 90% of lung cancers. Alcohol consumption. Alcohol abuse increases the risk of carcinoma of the oropharynx, excluding lip, larynx, and esophagus, and by the development of alcoholic cirrhosis, hepatocellular carcinoma. Moreover, the risk of cancers in the upper airways and digestive tract imposed by alcohol is increased synergistically when combined with tobacco use. Diet. Wide geographic variation in the incidence of colorectal carcinoma, prostate carcinoma, and breast carcinoma has been ascribed to differences in diet. Obesity. Obesity is associated with increased cancer risk. Approximately 14% of cancer deaths in men and 20% in women are associated with obesity. Reproductive history. Lifelong cumulative exposure to estrogen stimulation, particularly if unopposed by progesterone, increases the risk of cancers of the breast and endometrium, tissues that are responsive to these hormones. Environmental carcinogens. There is no paucity of well characterized environmental carcinogens. They lurk in the ambient environment, in the workplace, in food, and in personal practices. Individuals may be exposed to carcinogenic factors when they go outside. Example: ultraviolet rays, UV rays, smog, drink well water, example arsenic, particularly in Bangladesh, take certain medications, example methotrexate, go to work, example asbestos, or lounge at home, example grilled meat, high fat diet, alcohol. It appears that almost everything one does to earn a livelihood or for pleasure is fattening, immoral, illegal, or even worse, carcinogenic. Age. Age has an important influence on the risk of cancer. Most carcinomas occur in adults older than 55 years of age. Cancer is the leading cause of death among women aged 40 to 79 and among men aged 60 to 79. The decline in cancer deaths after age 80 is due to the lower number of individuals who reach this age. The rising incidence of cancer with age is likely explained by the accumulation of somatic mutations that accompanies the aging of cells. A decline in immune competence in older individuals may also be a factor. Tragically, children are not spared. Cancer accounts for approximately 10% of all deaths in children younger than age 15 in the United States, second only to accidents. However, the types of cancers that predominate in children are different from those seen in adults. In part, this is because pediatric cancers are more likely to be caused by inherited mutations, particularly in tumor suppressor genes and much less likely to stem from exposure to environmental carcinogens. Example, cigarette smoking. This difference explains why carcinomas, which are frequently caused by carcinogens and are the most common general type of tumor in adults, are very rare in children. Instead, acute leukemia and distinctive neoplasms of the central nervous system cause approximately 60% of childhood cancer deaths. The common neoplasms of infancy and childhood include the so-called small round blue cell tumors such as neuroblastoma, Wilms tumor, retinoblastoma, acute lymphoblastic leukemia, and rhabdomyosarcoma. So, dear readers, this is the end of the video of part 1 in the series on cancer, that is neoplasia, in the Medicine for Common Man series. Thank you for watching.